Hi, my name is Lucy DiCarlo, and I'm the National Manager, Patient Education and Support at the Leukemia and Lymphoma Society of Canada. This video is on chemo brain and fatigue, which we know are two common side effects that many cancer patients and survivors struggle with on a daily basis. Dr. Samantha Mayo is currently a postdoctoral research fellow in the Department of Medical Oncology and Hematology at the Princess Margaret Cancer Centre. Her research focuses on the late and long-term effects of illness and its treatment. Dr. Mayo will be discussing the issue of chemo brain. Below this video, you will see information on how you can get a free booklet titled Coping with Chemo Brain. Thanks, and enjoy the video workshop.
So in our short time together, I will be speaking about chemo brain, or mild cognitive impairment. So as we will discuss, this is an area of a lot of new and emerging research, but what we will talk about today is really what patients' experiences and the research to date has really taught us about what it is and what we can do to manage it. So first of all, what is chemo brain? So this term was originally developed, in response to the need to really describe this experience that patients were reporting around changes in thinking, attention, memory after treatment with chemotherapy. And this is particularly relevant for cancers that originated outside the central nervous system, such as breast cancer, in which the disease and the treatment weren't directly targeting the brain. Over time, we're learning that chemotherapy may not be the only cause of this phenomenon, as we see this in patients who have not received chemotherapy at all. So in recognition of this and the recognition that there might be multiple causes for that, the term mild cognitive impairment or mild cognitive dysfunction has been used more commonly recently. So in terms of the changes that can be experienced by patients, so to take a step back, cognitive functioning is really around the mental processes used to acquire and to handle information. So from the studies that have been done to date, what we know is that patients report difficulties with these things. So short-term memory. People can describe changes, difficulties with multitasking, particularly when those individual tasks require a significant amount of attention or focus. We see that patients often have problems with complex problem solving, especially under time constraints. Concentration or working memory is an area that can be affected as well. In terms of mental efficiency, often people will report feeling that they are a bit slowed in terms of their thinking, and certainly we see slowed information processing speed when we test these people in the laboratory. Patients also show challenges with word finding, so finding that word on the tip of your tongue and having a hard time grasping that is something that's commonly reported and found in patients. And also in terms of fine motor skills, manipulating small objects and things of that sort. So something that people often say is, I always had problems remembering names, or I've always had problems grasping those words at the tip of my tongue. What we're really concerned about here are really significant changes from what you might consider your baseline or your normal level of functioning. And in terms of why we call it mild cognitive impairment, we call it this because really these changes are, on the whole, they can be considered subtle, so oftentimes they're not overtly noticed by people or others, and even though you might feel that you're having some challenges. And they're also variable, so across different people might experience different changes in different abilities, as well as your ability might change depending on the particular demands of a situation. For example, multitasking at home might be very different than multitasking in the workplace. So how common is it? So estimates of the prevalence are really wide, anywhere from 14 to 85% of patients treated with chemotherapy. There's some research reasons for this, depending on how you measure cognitive functioning, the kinds of patients you include in studies, and so forth. So the truth is probably somewhere in between. However, we are starting to know that there are a range of factors that can really influence or worsen cognitive functioning, which can help to explain this wide range of percentages that we're finding. So these can include the types and doses of treatment and combinations of treatment. So chemotherapy in combination with radiation, in combination with hormonal therapies, all of these things can impact on cognitive functioning. Also, the side effects of common medications can also contribute to cognitive functioning. So here we're thinking a lot about analgesic or pain relief medications. Those can also impact cognitive functioning. Emotional distress, so as we've been talking about, there's a co-occurrence of symptoms that can happen. So around anxiety, depression, distress, and then as well as other symptoms such as sleep disturbances and fatigue and pain that can all co-occur and it can all be sort of tangled together and in the result worsen cognitive functioning. And we're also learning that comorbidities in and of themselves can also impact cognitive functioning. So even without the cancer, on top of it, things like multiple sclerosis or history of traumatic brain injury or concussion, HIV, and even some vascular diseases can have associated cognitive effects. One thing that I haven't listed here, but I will speak about, is really time since treatment. So more recently, studies are really following people over time to see how they do after treatment. And what it's finding is that for most patients, cognitive functioning will recover over time. What that length of time is may vary, but it seems to be that as general recovery occurs and as some of these factors subside, such as pain, if fatigue is better managed, some of the side effects of medications are subsided, cognitive function can often recover in parallel with that. But we're also seeing that there's a smaller proportion of patients who continue to have persistent cognitive effects over the long term. Unfortunately, we're still trying to pin down who those people are so that we can be better able to identify them early and be a bit more proactive. So on the whole, what we know so far is that there's a range of factors that can affect cognitive functioning and that they can be generally settled, but we also do know from patients that it can have a very significant impact on everyday life. So there's been a number of studies that have interviewed patients around their experience of feeling these cognitive changes, and common themes are often occurring. These include challenges with fulfilling social roles and responsibilities, particularly after the completion of treatment, when you're really starting to re-engage in some of your normal activities. Also enjoying things that you used to participate in. Things like, playing chess is something pictured here, but also leisure activities that you used to like to do. Also with this, returning to work can be difficult for patients who have persistent cognitive changes, depending, of course, on how well you're able to modify the types of work you do and find ways to cope with and to find ways to get the work done despite the cognitive changes. All of these things together, patients are saying that can really affect their self-esteem and their confidence in places like the workplace or in social situations. And this can also affect on relationships, be it, social relationships with people that you live with and work with. Also, if you continue to withdraw from activities you used to do, relationships based on those activities might be affected as well. There's also growing evidence that cognitive impairments can also impact on adherence to health regimens, anywhere from forgetting to attend doctor's appointments or also managing your medications. So this is just one quote from a study of patients who describe their experience. So in this quote, a woman describes it as this: "You have to fight to make yourself remember numbers, words, places that you go. Sometimes I would leave the house to go somewhere, and I really couldn't remember how to get there. It almost made me break down because of the fact that you think you're losing your mind." So what this really shows to me is really the significant impact it can have on patients' lives, and also around the fear and uncertainty that can really rise up when you're starting to feel these changes and you're not sure whether or not this is something that a lot of people experience, if this is something that's signaling something that should be alarming to you. And I think that hopefully this will be changing as the dialogue around mild cognitive impairment increases and healthcare providers become more aware of this as an issue. Whoops. For example, so as recently as 10 years is when people really started to pay attention in terms of the clinical community around Chemo Brain, as Dr. Fitch and Dr. Howell have alluded to. The growing increase in attention around late and long-term effects have really started to bring attention to this issue as well. So this is just an article that was published in the New York Times that really, brought it to the fore that, this is something that patients are experiencing and greater attention needs to be paid to it. And since this time, there's been a surge of research that's continuing today to really understand what are the underlying factors and what are the things that we can do to better understand what's happening so that we can develop strategies to prevent and treat this. So just as recently as last month, Canadian researchers published really exciting work using measurements of neural activity to show that brain functioning in patients treated for breast cancer were really different on a neural level compared to healthy women in terms of how they function. So again, we're really trying to understand what's underlying all of these issues so that we can better prevent and treat them. So in terms of what we know about how it can be treated, so this is just a screenshot of a review that was published last year by the Oncology Nursing Society in the US that really looked at reviewing the evidence around interventions for cognitive impairment. So what they found was that cognitive training is an intervention that's likely to be effective. So what is cognitive training? This has been defined as any intervention aimed at improving, maintaining, or restoring mental function through the repeated or unstructured practice of tasks which pose an inherent problem of mental challenge. So that's a mouthful. So what does that mean? Basically, cognitive training involves tasks that involve repeated challenges to things like attention, memory, thinking, and it's been shown to really improve your abilities in these specific areas that you're training. And so the evidence to date has really shown benefits when this is done as a group, but it's also been shown to be beneficial on an individual basis, so when people are doing it on a one-on-one basis. So far, the data seems to suggest that these interventions will be effective. Of course, the challenge in rolling it out, for example, for us here today is really how do you know how much you need to do? How do you access these programs? And how do you know which ones are the ones that will be effective? So I think as research moves forward, we'll start to delineate some of those issues so that we can better implement this. A number of other interventions have been tested, but unfortunately there's still some research to go before they can be fully recommended. Some of these involve cognitive behavioral training, which Dr. Howell mentioned already, which is really about thinking about and changing your beliefs and expectations to find behaviors that can help you cope through these symptoms. As well as exercise, which we know will have multiple benefits for some of the other symptoms that we talked about co-occur and potentially for cognitive impairment as well. But so far for that, studies have been single studies with small sample sizes, so not yet at the level where we can recommend that as a sure-proof way of improving cognitive functioning. Also, interventions like meditation or mindfulness-based stress reduction have been used to reduce some of the anxiety and distress around cognitive changes and have been shown to reduce people's sense of how their cognitive functioning has been decreased. Also, in terms of medications and supplements, vitamin E has been tested as an antioxidant, trying to address some of the cognitive impairments, as well as some of the psychostimulants that Dr. Howell mentioned as well in terms of drugs used in other indications such as ADHD, narcolepsy, and dementia. But again, these studies have been small in nature and largely with mixed results. So this review also highlighted some interventions that are unlikely to be effective or not recommended at all. And this includes ginkgo biloba, which is something that might be commonly sound familiar to a lot of people as a way to boost memory. So ginkgo biloba is a herbal extract which has a range of indications and has been tolerated quite well, but there's actually a few studies in cancer and cognitive impairment that show it hasn't shown benefit in this particular context. And in fact, because the mechanism of ginkgo biloba is thought to increase circulation to the brain, it has been shown to slow clotting and might have some blood thinning effects. So particularly with patients who have low platelets or who have other blood thinners that they're taking, that would be something that would be contraindicated. And then lastly, something that hasn't been recommended is erythropoietin stimulating agents. So these are agents that might be commonly used to treat severe anemia, but particularly because of some of the side effects related to cardiovascular effects, it's not recommended for use for treatment specifically of cognitive impairment. So overall, the evidence is still emerging around useful interventions, but there is are some things that are being done to being able to look at what might be able to help cognitive impairment. However, as I said, on the whole, it's expected that most people will eventually restore at least some of their cognitive functioning that they feel that they've lost after cancer treatment. As to whether or not that's fast enough for them or not is a different story, but in the meantime, there are also some self-management strategies that might be helpful and are commonly recommended for helping people cope through what they might be experiencing. And certainly when we get to the discussion point, would be very eager to hear what you find as helpful to coping with these issues. So things like taking notes, keeping a notebook beside you so that when you do have something you need to remember, to be able to jot it down. Some people don't use calendars, so for those who don't, implementing a use of a calendar in daily life to write down appointments and important dates might be useful to help to remember some of the things that you don't want to forget. The use of smartphones has been very helpful for a lot of patients that I've seen in my study, even just setting alarms for certain things, but also there's a range of apps that I haven't used myself but have heard about that can really remind you about things like taking medications on time and things like that. And then, of course, also speaking to your healthcare team and keeping in close contact with them about your experiences. And as Dr. Fitch and Dr. Howell mentioned, really speaking to them about the impact that it's having on you. So what are the things that you can't do? Are you having problems at work? Are you, having problems, paying attention when you're reading something? So that we can really help to keep track of how you're doing over time. And as well, they can direct you to the right resources that are available in your setting. Also, promoting overall health can also help in promoting your cognitive functioning. So things like getting adequate rest and helping to manage your fatigue. Also, physical activity and sometimes being outdoors has also been shown to help just with a sense of having a clear mind and being able to think a bit clearer. Also, being open to receiving social support from those around you. So be it peers who are having similar experiences or around the loved ones who you can share, what's going on with you so that you can have some discussion around that. And then lastly, around staying engaged with mentally stimulating activities that you can tolerate at a level that you enjoy. So things like maybe playing games, or even it can take many forms such as creative outlets. So things like art and music, things that you like to do that can keep you intellectually and mentally stimulated. So just in terms of summary, so changes in cognitive functioning are commonly experienced after cancer treatment, and these changes are often subtle but can have significant impacts on patients and families. What we're learning is that cognitive functioning can be influenced by a wide range of factors, and research to this end is still developing and still in progress. And more research, of course, is needed to support prevention and treatment strategies moving forward.